Isn't the idea of helping others worth taking a vaccine? My purpose here today is to persuade you to support making the COVID-19 vaccination mandatory nationwide. As someone living through a global pandemic, I have done research into the benefits of a vaccine. Whether you have been personally affected by COVID-19 or just seen the effects of it through news or other personal stories, you should understand the impact of making the choice of protecting yourself and others by getting the COVID-19 vaccine. After hearing the information I am going to share with you today, I am confident that you will understand the importance of getting the COVID-19 vaccine and why it should be mandatory nationwide. I will begin by explaining the problems, then cover the causes of the problem, and conclude with my solution. With our roadmap in place, let's begin. The problem is that some people oppose the mandatory COVID-19 vaccination nationwide. For example, according to a December 15, 2020 poll done by NPR, opposition to the COVID-19 vaccine was still at 29%, down from 37% in August and September of 2020. In other words, even though more people are agreeing to the nationwide COVID-19 vaccine, there is still a large number of people who oppose it. According to Sharon Lafreniere, Katie Thomas, Noah Weiland, and Peter Baker in their New York Times article, there was concern about the accountability held in the complications of the information in the rush to get a vaccine out during an election year. The article, originally published August 2nd, 2020, and updated on December 7th, 2020, stated there were concerns about the rush to provide a vaccine without fully knowing the side effects and vetting it. Those who disagree with mandatory nationwide vaccines said that there was not enough done during the development and research of the COVID-19 vaccine in the rush to get it out during an election year. Fast-tracking the vaccine and the development of the vaccine, which usually takes years, leads to the feeling that there is not enough known about the long-term side effects of the COVID-19 vaccine. Another example is that in a December 18th, 2020 poll by CNBC, only 57% of workers were willing to support a mandatory COVID-19 vaccine to return to work. In other words, almost 40% of workers were still against the mandatory vaccine. According to scientist and educator Zakiya Whatley in Scientific America's October 12, 2020 article, people are not sure of what the correct path to follow to keep them safe and to stop the pandemic. Since the beginning of the COVID-19 vaccination and pandemic, science has gained a lot of new information on the virus. It is no longer new to us, but the conflicting information and ways to keep Americans safe and healthy has changed so much that there is question about whether or not a COVID-19 vaccine would even work. In other words, Americans do not feel comfortable supporting what they feel is an underdeveloped vaccine. With our problem covered, let's move on to why there is opposition to the vaccine. There are two primary reasons why people oppose mandatory COVID-19 vaccinations nationwide. The first reason is that they believe that not enough is known about the side effects of the vaccine for it to be considered safe. According to the VOA, the Voice of America, which is one of the leading news broadcasters, December 3rd, 2020 article, even though African Americans were in the highest mortality bracket, only 14% of African Americans said that they felt safe and would trust receiving the vaccination. That means that 86% of African American people still do not trust the vaccine. However, the efficiency of the vaccine has minimal side effects and that are known, and they are being monitored for any changes to that or any more severe responses. According to Johns Hopkins medical researchers and experts, Dr. Marigaxi, Lisa Lockard-Marigaxi, MD, and MPH Dr. Garber Kellen in the article, Is the COVID-19 Vaccine Safe? Updated on February 24th, 2021. The vaccine side effects are still monitored after the vaccine is approved. This keeps the recipients updated on any changes that could happen and any other severe side effects that could happen. The second reason is that they believe that the COVID-19 vaccines are more about lining the pockets of pharmaceutical companies and less about keeping Americans healthy. According to the Pew Research, a nonpartisan research centers December 3rd, 2020 polls, only 39% of Americans felt that they were safe trusting medical scientists and researchers to have their best interests at heart. Those who did not think that the pharmaceutical companies held their best interests at heart thought that the vaccine was more about being the first to get it out. They wanted to be the highest paid, the most sought after. In other words, there is not a very large part of America's population that feels as if the vaccine was just made to keep Americans healthy and for medical advantages. They believe that it's more about profit than Americans' health and safety. However, any money made by pharmaceutical companies is moot because there is no out-of-pocket cost to the Americans. According to Reuters' December 23, 2020 article, Pfizer and the U.S. strike $100 million COVID-19 vaccine deal with $70 million due by June. The United States will pay at least $12 billion toward the Pfizer vaccine to supply to Americans at no cost. According to the Centers for Medicare and Medical Services, a part of the Department of Human and Health Services, the federal government pays for all COVID-19 vaccines. Although healthcare providers may charge a small administrative fee, none of these fees go to the pharmaceutical companies. In other words, the idea that the COVID-19 vaccines are about lining the pockets of pharmaceutical companies is nonsense. There is no benefit to the pharmaceutical companies. Now that we understand some of the causes of opposition to the vaccine, let's move on to the ways to solve this problem. The solution, which is to support the COVID-19 vaccination being mandatory nationwide, offers two benefits. The first benefit is herd immunity. That will be established once there are enough cases and people being vaccinated. According to the World Health Organization's December 31st, 2020 article, Coronavirus Disease, Herd Immunity Lockdowns, and COVID-19, a substantial number of people, presumably 75 to 80%, will need to be vaccinated in order for herd immunity to be achieved. Other vaccines, such as measles, polio, had to accomplish an 80 to 95% of people to be vaccinated before achieving herd immunity. In other words, without enough people receiving the mandatory vaccine, herd immunity cannot be accomplished and will not be accomplished just by exposure to the disease. The second benefit is that Americans will be able to suppress the pandemic and move into a healthier country. According to the Harvard Gazette's December 10, 2020 article, Dr. Fossey, director of NIAID, says herd immunity is possible by fall if enough people are vaccinated. We will be able to reach a herd immunity and have the ability to return to normal. This will help lower the contraction of the COVID-19 disease and be a step toward ending the pandemic. As you can see, according to these charts, as the number of vaccinations went up, the number of cases have gone down. So as we can see, the vaccinations started to be administered and the number of cases being reported went down. In conclusion, you should now be able to take the understanding of why a mandatory nationwide COVID-19 vaccine is necessary and why you should be willing to get one. Let's review what we've learned today. First, we learned the problem is that some people oppose a mandatory COVID-19 vaccination nationwide, as evidenced by the fact that 29% of Americans in general and 40% of workers are not supporting a mandatory vaccination. Next, we learned two reasons why some people oppose mandatory COVID-19 vaccinations nationwide. Those include the belief that there is not enough known about the vaccine and the side effects of the vaccine for it to be considered safe, and belief that the COVID-19 vaccines are about lining the pockets of pharmaceutical companies. However, we now know that it is safe and efficient with minimal side effects, and we know that money is not being made by the pharmaceutical companies, and that is moot because there is no out-of-pocket cost to the Americans. Finally, we learned that the solution is to support the mandatory COVID-19 vaccinations nationwide because it offers two benefits. Those benefits that are included are herd immunity and the ability to suppress the pandemic and move America onto a healthier country. Understanding why a mandatory COVID-19 vaccination is the best option for dealing with the global pandemic should tell you why taking a shot to help yourself and to help those around you is so important. This is why we should take the time to get a vaccine and to help support the mandatory COVID-19 vaccination nationwide.